I don't want to be.
No.
I think this is a good view.
That's bad. Them legs that look like she been walking the green mile forever.
You want to get right to see?
She got a Band-Aid on her knee.
She done got her.
Derek done bruised her up pretty good.
But baby, it's the first thing I
You done broke her hand?
Hey,
Done broke the hand
that's
and everything.
Her arm did a whole 360.
All right, so the other day I showed y'all how we would do EKGs in class. But basically what I'm gonna show you how is how a cardiologist would like y'all to put the electrodes on a patient. So most of the time if we have a female patient and they have a wire bra, we tell them to take the bra off because the wiring in the EKG can sometimes interfere, depending on what kind of machine they got. If they got state of the art, then it probably won't interfere as much. But back when I did them, I had to do it because the machines weren't that high tech. So basically, if we have to have the woman remove the bra, we usually put them in a gown and have the gown facing backwards where the ties are, so we can open it up to where we can see the sternum area of the chest. So V1 and V2. Now everybody knows that the leads for limb leads are still the same. You're still gonna go in the meaty part of the calf on the right and left leg. And then you wanna go in the, away from the brachial artery in the fleshy part of the arm, still the same. And of course you walk around your patient, so don't go like I'm doing. You actually walk around your patient to the left, right side. V1, if you are hooking up a patient from a cardiologist's office, you always want to remember you want the sternum. And it's the what? Fourth intercostal space, right sternum border. So it'll be here. Bloop. Say V2 would be what?
Fourth intercostal space, left sternal border.
So it'll be here. We always skip V3. V4 is placed how?
Mid-clavicular.
Mid-axillary point.
That's the armpit.
No, that's
No.
the clavicle.
Clavicle.
Mid-clavicle.
So it'll be here. Then V5 is perpendicular from V4, parallel from the clavicle. And then V6 is perpendicular from V5 under the armpit.
That's the axillary.
That's the axillary. So as you can see, I'm gonna stretch this out a little bit. V1, V2, 4, 5, 6. V3 goes between 2 and 4. Right there. Right. And then we would hook a patient up following the ground. So if we were to hook a patient up first, what lead would go first?
Right leg.
Right leg. Which in American Standard it is what color?
Green.
Green. By American Heart Association, it is green. So we would hook our patient up. I'm not going to hook Susie up because we won't read anything. Because if Miss Susie comes up with a heartbeat, I'm exiting out the classroom. And that's how. Anybody has any questions on how you would do it in a cardiologist's office? Now there is another way also. There's one other way. Now we would keep, instead of putting it on the calf of the leg, we can also put it on our lower limbs on the patient right off the pelvic bone. So we can also hook up leg leads here in the pelvic area, or same thing with arm leads. Arm leads we can stick right under your collarbone.
So that's what
That's
we.
for continuous, right?
That would be for continuous, yes, and you can also do it for a doctor's office also.
Is there a reason why they do it different?
Because if you have an amputee,
That's what my question I was about to ask.
yeah, if you have an amputee, not all amputees want you to touch their stump. We can still put an electrode on the stump, and it'll still give you a good reading. Well, usually if it's like the knee and below, we would still put it on the fatty part of the thigh.
Okay.
Well, away from the femoral artery, and not where the bone is.
What about if most of the thigh is going? Would you just stick it like
Then
up
you
there?
would have to do pelvic. You would do pelvic and then leg if they still had leg, or you can do them both pelvic.
Okay, that's not like that.
So what if they ground leg was like the one that was going like the right leg? You would
You
still.
would do pelvic.
So you'll still do pelvic first too, right?
Mm-hmm.
And that's just for amputees, you would do it like that, or that's like cardiologist?
For amputee is mostly like that. Or if the cardiologist would like it like that. There's even some cardiologists that let you take an EKG sitting. Sitting